cloud. Okay, everyone, thank you for joining our event today. This is Follow the Money, Taking Federal Action on Drug Policy Through Appropriations. My name is Rob. I'm the Policy and Advocacy Director for Students for Sensible Drug Policy. We have a great panel today with a lot of experience when it comes to budgetary processes, with money, with appropriations, and with drug policy reform in general. We'll be introducing them throughout this panel. The first part is going to be a presentation by Bill McCall, who has a lot of experience with the appropriations process, as well as drug policy in general. So I will let Bill introduce himself quickly, and then continue on with the presentation, and then we will introduce the rest of our panelists for our discussion questions.
Thank you so much, Rob. I'm really actually very excited to be here. I first started working with Students for Sensible Drug Policy, I think around 2000. So more than 20 years ago, and I'm so excited to see both the growth and how sophisticated I would say that SSDP has become in working on these policy issues. And honestly, I think it makes a major difference. So just a real quick bit of my history. I was the founding director of the Drug Policy Alliance's office is here in Washington, D.C., then went on to work for 16 years for AIDS United. And then for the last 2 years, I've been consulting, including doing a very specific consulting project on appropriations for Drug Policy Alliance. And so I'm happy to share what I know about about appropriations, which is basically the process of getting funding from the Treasury to the agencies that are providing particular services. I did lay out a few slides. I hope that this is helpful, but if you've got questions, I can answer them at the appropriate time when we have the after the panel discussion, I guess. So with that, I'm going to start moving my slides here. First, okay, there's yes. So here's our little bill on the hill. And so I wanted to talk a little bit about the political environment right now. The tone has changed a lot since I first started working with Congress in, I hate to say, 94. But one of the things that has absolutely started to happen is that there's been this move towards an incredibly partisan Congress where sort of every move is kind of weighed about the next election. And there's a lot of efforts to try to turn more or less every issue into a partisan space. And so one of the things that's been difficult, I think, for folks like myself who've been doing this a long time to handle is that, you know, finding spaces where we can accomplish things on a bipartisan basis is tricky. But I will also say it's more or less a space, you know, when you can be bipartisan, that's important, but it's not always required. I will say that one of the major things I always tell people who are coming to Washington to speak with their members of Congress or who are doing so back in the district is, you know, build out your relationships with your lawmakers. A lot of time, you know, they really do want to try to respond to constituents, and wherever possible, they want to do that. And a lot of times you can build a relationship with staff members when you can't, even if you're not directly in touch with the member of Congress. And those staff members can also often make major decisions. And I'll just say one example of this is on syringe services policy. I have now had the fortune, I guess, of overturning a ban on federal syringe services programs, not by myself, of course, but in conjunction with a lot of people now twice. And, you know, we're kind of in a space where there's still some lingering stuff on it, but right now funding can be used for syringe service programs, but not for syringes. One of the ways that happened was that folks in Kentucky really got busy and convinced the Kentucky lawmakers, including their state lawmakers and everyone, that they had that syringe services programs needed to be a part of the fabric responding to opioids. So that's a space that's there. I'm not going to talk too much about persuading policymakers. I feel like what we really want to talk about here is appropriations. So before I go into appropriations, what I'd like to tell you a little bit about, sort of, I think of Congress as being kind of a cyclical wheel. It cycles around elections, which are held every 2 years for each representative, and every 6 years for 1/3 of the Senate, and then the next 2 years it's 1/3 of the Senate, and the next 2 years is 1/3 of the Senate. So there's this cycle of 2 years that does have an impact on things. There are three sort of major functions of Congress. One is the creation of a program or the review of a program. That cycle is called authorization. So when you create a program that provides services, and I tend to think of like the Ryan White program, which provides funding for HIV treatment, among other things. And then you have a reauthorization maybe in 5 years or something like that. Because of the partisanship of Congress, a lot of reauthorizations are not really happening right now. The other process, the other two processes are the budget and the appropriations process. They take place once a year. So we're essentially on a yearly budget. And that's what the budget does is it actually sets the outer limits of the funding. And it typically comes in sort of three parts. The president will set out their budget first. And then the Senate and the House, they'll set their budget. If possible, they try to agree on the amounts. And if not possible, it doesn't matter. They're just going to move forward and set funding through the appropriations process. Technically, what appropriations is the Congress telling the federal, executive branch exactly what amount can be released by the Treasury to each agency. So Congress has the power of the purse. And of course, the president gets to sign the bill, but the amounts that tend to get set by the Congress. There are 12 subcommittees in appropriations. I think two that are particularly important to drug policy are Labor, Health, and Human Services, as well as Commerce, Justice, Science. Labor HHS controls essentially all of the public health spending, and I'm just about to talk more or less about that. The justice part of Commerce, Justice, Science controls things like Bureau of Prison spending, things like burn grants, stuff like that. And I think SSDP will want to kind of look through programs and go, hey, we support this, we are against this, because you can always say to folks, hey, we don't want to spend money on this particular program. So there's a lot of leeway there. But let me tell you a little bit about what I've been working on. So under the Centers for Disease Control and Prevention, there is an agency that works on HIV specifically. And it's actually on infectious disease. So you can see it also covers hepatitis, STDs, and TB. And within that program, there is a line called the Opioid-Related Infectious Diseases Program. And that line has been used a lot for things like surveillance of hepatitis. But one of the things that we realized is that that was a line in a very friendly agency with people who really understand harm reduction that could be used to fund syringe services programs. And in the midst of this absolutely historic overdose, really a poisoned drug supply situation, that getting funding out to people on the ground who are providing services, particularly around syringe services, but around naloxone, getting naloxone out into communities, things like that, with a friendly agency, that would be a really good space to do it. So we set out to try to get $120 million. And I don't know if you could see my little arrow moving here, but so the community came together to come up with an ask for this budget line. We came up with $120 million. That is nearly 10 times the amount from fiscal year 2021. The president only requested $6.5 million, although I have to say he was coming in, he didn't have much of a transition, and I don't think he really understood the community asked there. The House, however, actually did appropriate or pass a bill that would appropriate $56.5 million for this line. That's new, so a total of 69.5. And then the Senate has a committee markup that they're operating under lower caps, and that's a function of the budget, which I was talking about earlier. We are now in the process of trying to tell both the House and the Senate, when they pass a final appropriations bill, that we want them to go with the Senate number at $69.5 million. I will also say, part of this is all kind of a negotiation. I think people are probably aware that the process gets a little convoluted. I'm not going to go over the key lawmakers. I'll share these slides with you also that you can kind of figure some of that out. But one of the things that basically happens is that there's an overall process. The president releases his budget in February. The House and Senate attempt to pass a budget. They don't always succeed, and they don't necessarily match in March and April. And then beginning really almost right after the president releases his budget, but certainly by March, the House and Senate appropriations begins in earnest. And every lawmaker in Congress puts forward their requests to the appropriations subcommittees. So the CDC, Infectious Diseases and the Opioid Program, is under the House Labor, Health and Human Services subcommittee. And every single member of Congress has an opportunity to weigh in with the subcommittee by submitting what's called a form. And every member has a different form to that subcommittee. So one of the things that we think is extremely helpful is for people who are out there on the ground, who are in particular members of Congress's districts, who are constituents, who maybe have their parents as constituents in districts, to submit these forms so that those members of Congress know that this is a priority. So that's really sort of the main process. I will just add that one of the things that also happens is that going back into the budget process, the agencies start to devise their budget, really starting as early as August, but through the fall and the winter before the president releases their budget. And so you can see there's this cycle that goes around and around. We're off cycle right now because the fiscal year is October 1st through September 30th. Congress didn't pass their budget, that instead their appropriations bill. Instead, what they passed is a continuing resolution. And so that sort of continues. I realize I'm starting to get a little bit long here, and I know we've got other panelists. So I'm going to just very quickly let you know how to get to a form place. First, you need to determine your ask. Multiple asks are going to require multiple forms. You can only have one form per ask. Figure out who your legislative targets are and figure out who's going to send forms to those legislative targets. Figure out what the form deadlines are. Start looking in February and then start submitting forms. Now, the thing is, the forms all have a bunch of different information. So one of the things that is going to be helpful is if you can develop for each of your asks sort of a common form and then figure out what are the things that are being asked for. And then everybody can kind of use that form as a template, just varying it based on that. I'm betting that this group pretty much knows that there are 2 senators and 1 representative for each person in a district. But I will just say, if you can get the form submitted by a constituent or at least somebody in state, that's really going to make a difference. So that's pretty much my presentation. I feel like I have just touched the surface of this issue, but I'm really happy to continue talking to you and helping out with getting forms out to the process is just about to start up again. It's going to be January in less than a month, and once we hit January, it's going to be back off to the races. And frankly, we'll still be finishing up the old the fiscal year 22 appropriations, even while we're starting to work on fiscal year 23. So, Rob, I hope that gave you enough information, and I'm going to stop sharing my screen right now. I will share these slides back with you.
Nice. All right, thanks, Bill. So for this second part, we're going to open it up to the rest of our panelists. We're going to be having some other speakers today ask or answer a variety of discussion questions, and Bill, feel free to answer as well. So I will just have everyone introduce themselves as desired. Let's start with Mike, and then anyone can take it from there.
Hey, Michael Zuski here with the Enact Group. It's my consulting firm. I'm a consultant to SSDP on some issues and to the Drug Policy Alliance on some other issues. I use he, him pronouns.
Nice. Thank you, Mike. Let's go to Alvaro next.
Hey guys, how are you? Thank you, Bill, for all the information you provide. Really knowledgeable. Hi everybody. So my name is Alvaro Portillo, and I'm with BALCA, Bay Area Latino Cannabis Alliance, and I'm the Latin America director. So I deal with pretty much everything that has to do with Latin American cannabis. And thanks to Jason for this group, I've been digging more into coca and other emerging, issues related to drug policy. And I've been working in the cannabis industry for the past 6 years as a cultivator and entrepreneur myself. And yeah, thank you.
Excellent, thank you. Let's go for Robert next.
Hi guys, my name is Robert Suarez, and I am with the North Carolina Urban Survivors Union, as well as the Urban Survivors Union, which is a national drug user organization. I've done some work around trying to get the laws moved, or rather get the needle moved, I should say, when it comes to drug policy and public health. And I'm looking forward to an engaging discussion tonight.
Thank you for that. Yeah, so let's get into these discussion questions, and folks, feel free to turn cameras on if you'd like, but otherwise let's just get into these questions. So first we have, and anyone can answer these, if we have a lack of responses, we can try to popcorn, but let's just start off with the first question. So what kind of drug policy advocacy does your organization engage in? And how do you think that you could use the appropriations process to further your goals? So I'll just leave it at that. Let's give it a few seconds for anyone to answer as desired.
Hey, happy to jump in and get this started. This is Michael Zuski here. So my consulting firm, like I said earlier, we do work with both SSDP and the Drug Policy Alliance. So for DPA, we do work on marijuana reform issues primarily, and with SSDP, it's some broader drug war issues. And there's a lot of avenues that the appropriations process can be used for on marijuana reform or broader drug policy reform issues. Bill did a great job outlining the appropriations process and describing how, the real basics of how you can begin to get funding for something through the appropriations process. There's another way you can use the appropriations process, though, that I want to make folks aware of, and it's been used a lot by marijuana reform advocates. We've had some success on this. In fact, the only things we've been able to pass all the way through in Congress have been this approach, and those are spending riders. Those are restrictions that prevent the government from spending money on a certain activity. So with marijuana, one of the ones we've been successful with was it used to be called the Rohrabacher-Farr Amendment. Those were the two congressmen who were the sponsors of it. And it prevented the Department of Justice from going after people complying with state medical marijuana laws. It's still in effect. It's still on the books. It's been held up in court. It took the form of an appropriations rider. It basically says the Department of Justice can't spend money. All right, so I guess that was a prompt for me to wrap up. But that's just one way of being. Another way that you can use the appropriations process in drug policy advocacy is to prevent the government from doing things. And you can also use this to raise the profile of issues, because appropriations comes up every year and Congress has to pass the appropriations bill. It gives you a vehicle to shine a spotlight on an issue where the government is spending money on something that they probably shouldn't be, and you might be able to build off of that to pass full legislation rather than a spending restriction. So I'll leave it at there for now.
You know, I may hop in just to very quickly highlight a couple of things that we're doing. I will just say that appropriations touches every program that's out there. There's a guy here in DC that I used to run into who literally all he did was to defend the nests, nesting turtle sites along beaches. And he had funding that was coming down through the environmental thing. I mean, it could be as specific as that. And so I guarantee you that any program that has any federal funding that's going towards it is something that you could potentially weigh in on. I will say, Michael reminded me to say, there's been this rider on the labor HHS bill preventing funding now from going specifically for the purchase of syringes or similar supplies. For the first time ever, we were able to get that lifted as well in the Senate mark this year. So I'm hopeful that this might be the first year that we've actually fully lifted any type of ban on syringe funding. The only other thing I will also point out is that there is now what is referred to as an earmark process that is allowing individual programs to receive set aside funding from Congress. They brought that back in part because it helps to sort of create an incentive for voting in favor of bills like that. And so if you've got a local program that I'm going to try turning on my camera here. There we go. If you've got a local program that you want to support, like a syringe services program or some sort of space like that, that might also be something that your local chapter might consider taking on as well. So those are the kind of things that we're looking at. So that's my extra 2 cents.
So just really quickly, I'm really not too much of an expert when it comes to the Appropriations Committee and so forth. But I will say that when it comes to syringe access, that's something that we've all been trying to get pushed through for God knows how long. And it's just really sad that when it comes to anything that has to do with people who use drugs or drug use, our government falls short on making it happen. And as we are supposed to be like this awesome country that does so much, we are a third world country in the eyes of so many others. And we're just finding it hard to believe that we will see anything in the near future that has to do with whether it's syringe access or anything like that. And I hate to be the devil's advocate of this group, but I've been fighting for the past 10, 15 years on trying to get bills like that through. And I have to say that there are representatives out there who just do not care about this stuff, and they will put their names on a line item or whatever, but at the same time they'll turn their backs when it comes to that vote. So until we start to come together and get away from these I call them like this satellite groups come together on one or two particular issues and literally put up a fight and rock the boat. I don't think we're going to see anything get done really.
Hey guys, I honestly as well, I don't have too much knowledge about the appropriation process, but I was doing some research this morning and I figured it out. Like Michael and Bill just said, it just touched so many parts of pretty much a lot of the laws that affect. And in cannabis, Michael, like you said, I was just reading there something about like banking that apparently was able to do through that process. And there was some more stuff like access to cannabis for veterans that wasn't allowed to. So it's obviously it's like really interact with so many aspects of the federal government. So it's really interesting for sure. And we're gonna try to utilize those tools to see what we can do more. We have a lot of action when it comes to local level with city council and the mayor and city, but never like to that scale. It seems so far away, but at the same time, I feel like there is a lot that can be done. And thank you so much for sharing.
Yeah, I think those are a lot of good answers. And then unless anyone has any follow-up from that, I'll go to the second discussion question. I might save the third one in case we don't have any final comments or questions. But unless anyone has anything else on that first one, I'll just go to the second part, which is how do you think young slash new drug policy reformers should engage with the appropriations process? I think SSDP has an answer for that, which we'll be talking about at the end, but I want to see for folks. I think one of the things that we are considering is that just like this process and stuff with Congress and budgets sounds very not approachable to students. So what would be a way either that you think or that you've tried that could bring new drug policy reformers into this process?
So this is a really interesting thing. I think that this is an area that in a lot of ways has a lot of specialization, but it's also an area where expertise pays off. So if you've got a few people in your chapters who are really willing to kind of figure out the process, understand how it works, and then work with your members of Congress, either near your campus or within the state, that would actually really, I think, pay off for some folks. Now, there's a reason that folks hire people like myself who have done this for 20 years. But this is the thing about being a student. This is your opportunity to really learn this thing. And I guarantee you, it's the kind of thing that'll just like pay off over and over, because no matter what you kind of eventually end up going into, having the knowledge of how this works and how to engage the appropriations process is amazing. I'm going to also add one other quick thing, which is I do find that the staffers of most members of Congress are going to be pretty open to, helping maybe walk you through it. And I would say, particularly one way to figure this out is to figure out who's a staffer in the district that you can have a meeting with, tell them what you're trying to do, and then they can sort of help you motivate your way through it. I do think SSDP has a big role here that they can play too by centralizing a lot of the information, because the real trick here is you want everybody singing off of the same choir book, right? And sometimes you don't necessarily want this to be like, you don't want it out on social media and tweets what you're trying to do. Rather, what you want is, hey, we've got 30 people who said the same thing to our member of Congress, so that they know that this is, an issue within the district. So I think, finding that expertise, somebody who's, kind of real interested in the money around drug policy, man, this is your jam. It's interesting if you kind of get into it.
I wouldn't put too much past our younger generation when it comes to them wanting to understand our legislators in the government, in the ways in which it works. I know SSDP has been a huge source of go-to people when it comes to things like that. I know for a fact that there are a number of individuals and young individuals coming into not just harm reduction, but drug policy as well, wanting to know more and more. And it's a matter of just engaging them and letting them know that they have more power than they know. And I have no doubt that there are more people out there who are of the younger generation who are looking to engage in all this stuff.
I'll just build off a couple of those points in that it can be helpful to take a look at who in your community is doing similar work already, and finding out one who your allies are, but what other things are happening in progress. So like, if you want to get funding for harm reduction services, but you're not specifically sure what's already going on with that, getting plugged in with your local harm reduction network, they're gonna probably be aware of some of those specific things to start asking on. They may already have some of that messaging to build off of. And so that way you can expand the network of allies, begin to work with people who are already working on this. That's a way for you to interject your ideas into the space as well, by building those relationships. And like Bill said, this process happens every year, so there's always going to be an opportunity to learn it, and then those skills are always going to pay off because it's going to come up again next year, and you're going to get better at it each time. And I wouldn't worry too much about not knowing everything about the process. A lot of congressional staffers don't know everything about the process. I've been doing appropriations work for about 10 years on and off. I'm still learning things about the process. And so, I wouldn't let that sort of inexperience hold you back. The only way that you ever learn this is to throw yourself into it. And you'll probably make a couple mistakes along the way, but that's okay. The key is to learn from those mistakes and build off of them. And again, if you're working with a network of allies, you're going to stay focused on that goal.
See, Alvaro, do you have any thoughts on that?
Yeah, so I think it's really interesting what you guys are saying, and what is more interesting to me is that's where you really change happen. It's like we think about like elections and things like that, but all those things I always change it. But like all these programs are so old, like we're still fighting like the drone wars from like forever, and still dealing with these issues. One of them is crop eradication, what we're trying to achieve now, and just getting putting the word out and just understanding this process, you can get a lot of things done, and I think it's a great opportunity, like you say, for students. And it's, there is always going to be issues that we need to be changing. I mean, we're an evolving society, but a lot of these things continue to repeat because nobody tried to. So I think that there is a lot of possibilities for young students in this field just to learn and grow. I think it's really amazing. Thank you.
Yeah, I think those are a lot of good comments again. So thanks everyone for that. I want to make a quick plug for our aerial crop eradication or anti-aerial crop eradication campaign going on at the moment. Jason, feel free to add any notes and documents from that. But yeah, so currently, and part of the reason that we are hosting this panel tonight is because SSDP is beginning our campaign to eliminate funding for aerial crop eradication of psychoactive plants, including coca, and especially coca in Colombia. So we are looking, to remove funding from that, replace that funding with alternative development programs that we're figuring out. But first, just removing the funding for those crop eradication programs. They're a threat to public health. They're a threat to farmers' economic security in Colombia. And we think it is, due to like a drug policy justice issue, economic issue, public health issue, that it is time to end that deadly and dangerous program. So if you are looking to work with us on that, feel free to email us at policy@ssdp.org. We can add you into that group's work. I believe the next meeting is next week, so we can plug you into that. So again, you can just email at policy@ssdp.org. We can get you plugged into that. So that is going to be one of your action items for tonight, besides starting to get in contact with your members of Congress and see what you can turn an email into what sort of earmark, as Bill said before. But yeah, I'm actually going to open it up to any questions folks might have. I'm just going to give it a minute to see if folks have any questions, and then I will do the last sort of question I have here, any final comments, and then we can wrap up. So I want to give a moment, feel free, we have a few participants in the chat, so feel free to use the Q&A function. We can answer any questions, I'll give it a minute, and then if we don't have any questions, we can get to that last piece and then do any final comments. Let's see. Looks like Jason has a question here, and anyone feel free to use the chat or Q&A for any other questions. Is there a difference in the process for trying to get something cut versus something added? So I guess just removing funding versus putting funding in.
Not really. It's helpful to be able to make the request. It's through the same form, and you would still be wanting to marshal your same level of evidence about why you want something cut instead of something added. So for the most part, no. The riders, I guess, are a little bit different from the actual funding, but typically, even so, you can still, ask for, say, a rider to be removed through that form process, and also just through engaging with members of Congress. I think that's kind of the main thing. I will say, whenever you ask for something to be cut, remember that there's somebody on the opposite side who's probably arguing for it to stay. So, that's going to be one of those things. Is you also want to you might want to do one of those SWOT analysis, threat, figure out what are the opportunities, the threats, the resources that you have, and all of those kinds of things. So that's something to be aware of. But no, I would not say there's a fundamental difference. Michael, you might have a different opinion than I do.
The one difference, and I think it's with the riders, is you have a little more flexibility on the time. If you're trying to get something funded, you got to go through the forms. If you're trying to get a rider, that can come during the markup process as an amendment, and can be done sort of, you have more time to work around that. So if you're just trying to prevent the government from spending something on a particular thing, and you haven't been able to timely work the forms, you still have a bite at the apple. It's the sooner you can build the groundwork for an amendment, the better. But you have a little more flexibility, I think, in the timing with a rider.
I agree with that. Rob asks, it looks like, is there a way to figure out who's trying to fund something you want to eliminate funding for? They don't typically make the forms public. So really the only way to find out if there's someone sort of specifically in the district that's, in opposition, is if they're, you could talk to the staffers and just ask them what they're hearing. I think they would typically keep that information quiet, but you can always sort of think about who who's going to be in opposition. So for example, say you wanted to eliminate so it's state foreign ops to eliminate the Colombian eradication program. And actually, you've got a great chairperson of the subcommittee, Barbara Lee, to work on that. But I guarantee you that it's going to be folks who are, subcontractors, maybe the military, some of the DEA type folks who are super involved with supply side, those are going to be the folks that are going to be in opposition. So part of it is you can kind of surmise where you would expect things to come from, and then from there you might want to take a look at what they're arguing in front of. The other thing is, check the, figure out a couple key phrases and check some of the websites to Google or I don't know, DuckDuckGo or something to kind of figure out where what the arguments are on the opposite side and build a counter to those arguments. That's something that might be helpful in submitting forms anyway.
Very good. Okay, thanks everyone for that. I think I'll just move on to our last discussion question here, and then we can go into any final comments. So this is pretty open for anyone, but if you could fund one program related to harm reduction or decriminalization, anything related to drug policy, what would it be? Or you can say, if you'd like to remove funding from one program, what would it be? So yeah, let's start with Alvaro first, and then go to Robert, Mike, and Will, or Bill, rather.
I would say, in my opinion, just maybe if there would be a way to grant access to medical cannabis through some medical thing, just like some type of program. For instance, as the BA will be one, or maybe something even broader, something like some healthcare type of thing, that could be allow it, and not only allow it but not punish, because that a lot of people is just seriously when they know that they have something to do even with the industry, that are really bigger repercussions for them and for a lot of things. So I will say something around those lines. Yeah, most definitely.
So for me, being the harm reductionist that I am, and working with people who use drugs, I would, if there was a way that we could get, for lack of a better way of putting it, lack of a better word, using safe injection facilities established here in the United States, just and the reason why I say it like that is because they're not just safe injection facilities. They're facilities that work towards reducing the harm and helping individuals find a better way to use across the board. You know what I'm saying? Whether that's marijuana or anything else. We are once again, we are such a third world country when it comes to these things. It's sickening and saddening to think that the United States will not step up and look at the science to all this and just say, you know what, we need to just make it happen. So yeah, when it comes to that, I would just say safe injection facilities.
So I'll sort of answer both questions in that the program I would cut if I had a magic wand and could pull it off is the Edward Byrne Memorial Justice Grant program, commonly known as Byrne JAG grants. These are the grants that basically subsidize the war on drugs at the state and local level. They're responsible for a lot of mass incarceration, quite frankly. A lot of bad law enforcement activity is subsidized out of this. It's about I believe it's about $500 million each year annually. It's divvied up amongst the states. There were some reforms a couple of years ago that probably reduced some of the awfulness around the edges of it, but the funding levels are still very high, and it's an awful waste of government money. I would love to see that money redirected into exactly the types of programs that Robert was describing, safe use facilities, it would be great if we were funding those and subsidizing those at the federal level. And we might see some real good improvements to the quality of life for individuals who use drugs. So I would like to get rid of burn jag and move that money over into public health related harm reduction services.
Wow, Mike, I have a client who is getting a burn jag grant too, and I'm like, but no, I agree with you. As long as that funding follows that client, it doesn't have to be in the burn jag grant. I guarantee that the clients, they're pretty, they're doing decent things, keeping people out of prison, and but yeah, so that's where it's funny how those I guess the gradations of hey, can we find money here? Can we turn it to good stuff? That's always a little bit of a thing. I will just say, I'm going to echo Robert. I think that we absolutely should be funding overdose prevention centers or safe injection facilities. They're much broader than the just syringes, but I would even couple that with a broad expansion of harm reduction services throughout the United States. So a complete scale up, to the tune of billions of syringe services plus OPCs plus housing, for people who use or are affected by drugs. And, to the extent that we could, if we could match the kind of funding that the substance use treatment and prevention field is already getting, and in many cases, I think could be spending better or at least more directly on people who are directly at risk. I think that would be really, really super. So that's the kind of broadest thing that I would really love to see.
Nice. Okay, thanks everyone for those answers. I definitely think that was a really good way to end this. So I think we'll just use the last couple of minutes for any final comments, tying together loose ends, etc. I'm just going to make one more pitch for our campaign to remove funding from aerial crop eradication for psychoactive plants, including coca, in Colombia. So again, if you're interested in participating with us on that, email policy@ssdp.org. We have a few legislative contacts we are trying to target. One of those is Representative Lee, so very excited to be connecting with her office soon. But yeah, feel free to participate in that. Any other SSDP involvement you'd like to have, feel free to email me at roberts@ssdp.org. And then if you want to connect with any of the panelists after this, just email me or policy@ssdp.org. And I'm pretty sure we can get everyone connected. So yeah, I think we're good to wrap up. If anyone has any final comments, feel free to say them. If you want to represent your organization one more time, feel free to do so. And then we can just wrap things up a little bit early.
Yeah, I just want to say really quickly, I am, and I probably shouldn't be saying this, but I almost felt a little bit out of my element because of the discussion around appropriations committees, which is something that I'm not really too familiar with. But this right here has been an education. So I want to thank you, William, and I just want to thank both of you gentlemen for bringing your knowledge to this conversation. One of the things that I have a big problem with is how siloed we are in the United States when it comes to a lot of the work that needs to be done, particularly around drug policy. If we were able to come together on one or two issues as a massive movement, I'm pretty sure we could see the needle move forward a little. It's just sad that we are divided in that way, and until we come together and get away from being siloed so much, it's going to be difficult to really move the needle. So I just wanted to say that, and I want to thank you, gentlemen, for helping educate me.
Hey, Oh, I'm sorry, Rob. I would just like to say thank you, Bill, Rob, Jason, Michael, everybody, for putting this incredible educational event. And yeah, I didn't have too much knowledge about it, but listening to this, it truly excites me, and I think we can get this done. Yeah, thank you.
I'll just say for my part, I am truly grateful for the work, Robert, that you do, as well as Alvaro, on, at that local level, trying to ensure safety of the community and that consolidation that Robert spoke of. I think that's so incredibly important. I will say that one of the things that I am encouraged about is that at the federal level, ONDCP, at least with this administration for now, has changed its tune and added harm reduction as one of their planks, one of their priorities, as well as pledging to begin to end equity and disparities in the impacts of the drug war. I don't know that they've got the analysis that will actually enable them to get that far, but I certainly have seen, at the Substance Abuse and Mental Health Services Administration, which has not been friendly overall to people who are interested in harm reduction. They're starting to take on the task of understanding harm reduction and beginning to try to integrate it. And I think hopefully they'll be a little less hostile. But I'm grateful to, like I said, everybody at the local level. Drug Policy Alliance, I think is, and Michael could speak to this too, but that Drug Policy Alliance is committed to continuing to work on things like appropriations to begin to shift that money away from the bad things into the good things. And I'm confident that we'll keep on struggling and eventually we'll get someplace a lot better than where we're at right now.
All right, and then Mike, anything to final wrap up with?
Yeah, just thanks for having me, Bill. Really appreciate the presentation. I think that was a great succinct introduction to this process and made it easily digestible for folks who are new to this. One of the things that I take the greatest pleasure in is being able to help folks who are working at the grassroots level, whether they're directly impacted individuals or people who are providing direct services, and be able to either connect them directly with members of Congress or to be able to bring their concerns, the things they're working on, and to make sure that those are heard on Capitol Hill. So I really appreciate everything that folks like Robert and Alvaro that you're doing. And wanting to make sure that it's reflected ultimately in how Congress spends its money. It's an ongoing struggle. There's going to be good years. There's going to be bad years. The momentum's going to feel like it's going to be shifting in various directions along the way. But ultimately, I think we can get a lot of good done through this process. And the other thing is, this process isn't going away. If we ignore it, all the people with not so great interests are going to be grabbing all the federal money and doing it without us standing in the way. So it's good to be involved, and I'm glad that we're making these connections and excited about what we can do moving forward.
Nice. Well, thank you, everyone. I just want to give thanks to everyone who was able to attend and everyone who was able to speak today. I think we have about 2 minutes left, so I'll just let you go a little bit early. But just want to thank everyone again. Once again, if you would like to be involved with our campaign to eliminate funding for aerial crowd eradication in Colombia, please email policy@ssdp.org. We really need your help. Obviously, it's us versus military contractors and whatnot, so we need a lot of help. And I know we have a lot of help inside the network as well as our allies and supporters outside of it. So again, email policy@ssp.org, and otherwise, have a great evening. Talk to you soon.